Hi, and welcome to this episode of Rosie the Riveting RN. I am Professor Poole, and I will be going over today the LaCharity text, some priority and delegation questions. And this is the text that my students use. It is the 5th edition of the Prioritization, Delegation, and Assessment Practice Exercises for NCLEX RN examination by LaCharity. So let's dive into it. The 4th chapter, which is what we're going to be practicing today, that is going to be your fluid, electrolyte, and acid-base problems. So let's dive into the first question. So a patient is receiving IV fluid of normal saline 0.9% at a rate of 100 mLs per hour. Which effect on red blood cells shown in the figures below would the nurse expect? 1, 2, 3, or 4? If you choose 4, that is absolutely correct. The reason why is because 4 is showing the results of an isotonic solution. Now, a solution that is isotonic, that means that it is equivalent to your blood's concentration, which is going to be your lactated ringers and even your normal saline, which you're probably going to be giving quite a bit. So number 2, this is what happens when you give a hypertonic solution. A hypertonic solution has more concentration in the solution and is going to draw out fluid in the cells, out of the cells, I should say, and causing them to shrink. Number 3, this is what happens when we give a hypotonic solution. This is going to cause your cells to swell. And then number 1, that is an example of what sickling cells look like when you have a patient with sickle cell anemia. So I think what kind of throws people off in this question is going to be the rate per hour, the mLs per hour. Really, that doesn't matter. The key term in this is going to be normal saline IV fluids. And this is exactly what those cells are going to look like when you give those isotonic solutions. So let's move on to number 2. So the RN is admitting a patient with benign prostatic hyperplasia, which is basically an enlarged prostate, to the acute care unit. The patient describes an oral intake of about 1,400 mLs per day. What is the RN's priority? The RN's priority is number 1. Let's see. Ask the patient about his bowel movements. 2. Have the patient complete a diet diary for the past 2 days. 3. Instruct the patient to increase oral intake to 2 to 3 liters a day. Or 4. Ask the patient to describe his urine output. If you chose number 3, that is absolutely correct. So we actually do want patients with BPH to have a fluid intake of about 2 to 3 liters per day. This is going to help prevent any type of infections, particularly UTIs in the patient. And this is going to make sure that the urinary system is still intact. All the other ones, those are good ideas. However, we are more concerned about, how much they're able to take in and educating them on that. Number 3, the patient has a fluid volume deficit related to excess fluid loss. Which action related to fluid management should be delegated by the RN to the assistive personnel known as the AP? Let's look at your options. Number 1, administering IV fluids as prescribed by the healthcare provider. 2, providing straws and offering fluids between meals. 3, developing a plan for added fluid intake over 24 hours. Or 4, teaching family members to assist the patient with fluid intake. If you chose number 2, that is correct. Now, the question was asking basically what the scope of practice was for an assisted personnel, that is going to be like your CNAs. CNAs cannot administer any type of medication. They cannot develop any type of care plan. That is the scope of practice for an RN. And they do not teach patients or family members or caregivers anything. They can reinforce information that has already been taught. Now, if the options did say reinforce education, then yeah, they can do that. However, it didn't, so that's why it's wrong. Number 4, the assisted personnel AP reports to the nurse that a patient's urine output for the past 24 hours has been only 360 mLs. What is the nurse's priority action at this time? 1. Place an 18 gauge IV in the non-dominant arm. 2. Elevate the patient's head of the bed at least 45 degrees. 3. Instruct the AP to provide the patient with a pitcher of ice water. Or 4. Contact and notify the healthcare provider immediately. If you picked 4, that is absolutely correct. Now, having a poor amount of urine output, that can actually be a medical emergency if this is not something that would be expected in the patient. Now, when this would be expected would be if a patient had their dialysis done that day. Then yeah, it's very possible that they can have little to no urine production or output. However, if this is not the case and this is a new acute finding, then yeah, you got to call the provider. That can be a medical emergency. That can be a sign that the kidneys are shutting down. Having low to no urine output, that can be a trigger to call rapid response. So let's go on to number 5. The patient is at risk for poor perfusion related to decreased plasma volume. Which assessment finding supports this risk? 1. Flattened neck veins when the patient is in a supine position. 2. Full bounding pedal and post-tibial pulses. 3. Pitting edema located in the feet, ankles, and calves. Or 4. Shallow respirations with crackles on auscultation. If you picked number 1, that is absolutely correct. The other options those are signs of fluid overload. Now, the key term in this is decreased plasma volume. That's basically the same thing as fluid volume deficit, right? There's a deficit or not enough fluids in the body. And so they will definitely not have a bounding pulse, right? They're going to have a weak, thready pulse. They're not going to have edema. They're going to have really poor skin turgor. And they're not going to have those shallow respirations with crackles. The reason why is because their lungs are going to be dry. Number 6. The nursing plan of care for an older patient with dehydration includes interventions for oral health. Which interventions are within the scope of practice for an LVN, LPN being supervised by an RN? Select all that apply. Now, I know people get really freaked out with select all that applies. This is how you want to approach them. Take it one by one, right? One option by one option. And then you're going to look at each option as true or false, yes or no, or does this help, harm, or do nothing for my patient? So number 1, reminding the patient to avoid commercial mouthwashes. Yes, the key term is reminding. That means that they've already been taught this by either the doctor or the RN. Encouraging mouth rinsing with warm saline. Yes, they can do that. Assessing skin turgor by pinching the skin over the back of the hand. No, the key term with this is assessing. LPNs do not assess, they gather data. Number 4, observing the lips, tongues, and the mucous membranes. Yes, they can observe. That's one way they gather data. 5, providing mouth care every 2 hours while the patient is awake. Yes, they can definitely do that. Seeking a dietary consult to increase fluids on meal trays. No. The reason why number 6 is incorrect is because that is basically creating a care plan or any type of consult. That is going to be the scope of practice of the RN. That's not the scope of practice of the LPN. So let's move on to the next page. Ooh. The healthcare provider has written these orders for a patient with a diagnosis of pulmonary edema. The patient's morning assessment reveals bounding peripheral pulses, a weight gain of 2 pounds, pitting ankle edema, and moist crackles bilaterally. Which order takes priority at this time? 1. Weigh the patient every morning. 2. Maintain accurate intake and output records. 3. Restrict fluids to 1,500 mLs a day or administer furosemide 40 milligrams IV push. If you picked 4, that is absolutely correct. So remember, in this question, it says that the doctor has written these orders, right? These are the orders that have already been submitted by the provider. So you don't have to worry about, do I need to put this order in or not? So the most important one of these is to get that fluid off the patient. All of these options are needed. All of these orders are absolutely needed. However, what we need to do right now is to give them a medication that is going to remove that excess fluid. The body cannot sustain an excess amount of fluids on organs for an extended amount of time. It's going to be pretty damaging to the organ. So that's why we got to work to get it off. Okay, so number 8. Which statement related to dehydration made by a patient with hypovolemia is the best indicator to the nurse of the need for additional teaching? Now, when you have a question like this where it says, does the patient need extra teaching or something like that, you're actually looking for a statement that is incorrect, right? Because if you need additional teaching, that means you're not understanding something. So let's look at our options. Number 1, I will drink 2 to 3 liters of fluid every day. I will drink a glass of water whenever I feel thirsty. I will drink coffee and cola drinks throughout the day. Or 4, I will avoid drinks containing alcohol. If you picked number 3, that is absolutely correct. The reason why is because coffee and cola is actually pretty dehydrating. And then if you're having any issues with hypovolemia, you have low fluids, the last thing that you want is to have an intake of fluids that's actually going to cause you to diurese and be even further dehydrated. So that is why number 3 is going to be the incorrect statement. Number 9, the nurse has been floated to the telemetry unit for the day. The monitor technician informs the nurse that the patient has developed prominent U waves. Which laboratory value should be checked immediately? 1, sodium, 2, potassium, 3, magnesium, or 4, calcium. If you picked 2, potassium, that's absolutely correct. So you want to think of kalemia as cardiac, hyperkalemic, hypokalemic, either way, it's going to be cardiac. So anytime that you have a question that talks about electrolytes and cardiac, it's going to be kalemia, which is potassium. Anytime that you have something neuro-driven like seizure precautions or you're worried about seizures, it's going to be neutropenia, or neutropenia. Oh, I'm so sorry. That's the wrong word. Hypernutremic. Hyponutrient. So that's going to be your sodium, right? Neuro is going to be neutropenia. Magnesium, it can be cardiac driven, but it's most likely for like the NCLEX. NCLEX really loves to pair magnesium with deep tendon reflexes. With calcium, the NCLEX really loves to pair calcium with like fractures, bone, teeth, stuff like that. Okay, so moving on. A patient's potassium level is 6.7 milliequivalents per liter. Which intervention should the nurse delegate to the first year student nurse under his or her supervision? 1. Administer sodium polycisterine sulfonate 15 grams orally. Administer spironolactone 25 milligrams orally. Assess the electrocardiogram strip for tall T waves. Or administer potassium 10 milliequivalents orally. Now let's break this down bit by bit. Now the patient has high amounts of potassium in their blood. The concentration of the potassium in the blood is too high. Therefore, you can toss that bad boy out. We're not going to give potassium when you're already high in potassium. You're going to kill the patient. The nursing student does not usually have the skills to look for a tall P wave. So we definitely would not be delegating that to the nursing student. Spironolactone is not a good idea because it is potassium sparing. That's going to hold on to potassium, and look at that potassium level. It is already elevated. That would lead to administer sodium polycisterine sulfonate 15 grams orally. Now, what can happen with this is that this can help decrease the potassium level by removing the potassium in the blood and putting it back into the cell where it needs to be. And then that helps remove sodium out of the cell as well, balancing out those two lab levels. And this can also help you urinate the potassium out as well. So those are your options. 11. A patient is admitted to the unit with a diagnosis of syndrome of inappropriate antidiuretic hormone secretion, also known as SIADH. For which electrolyte abnormality would the nurse be sure to monitor? 1. Hypokalemia. 2. Hyperkalemia. 3. Hyponatremia. Or 4. Hypernatremia. If you picked number 3, that's absolutely correct. So the patient can have decreased amounts of sodium, and this can actually be because it's too concentrated, because they have increased thirst, or because they're urinating it out, and so it makes the concentration too low. Number 12. The charge nurse assigned the care of a patient with an acute kidney failure and hypernatremia to a newly graduated RN. Which actions can the new RN delegate to the assistive personnel? Select all that apply. Remember, this is true, false, yes or no, or does this help, harm, or do nothing to my patient? 1. Providing oral care every 3 to 4 hours. Absolutely, yes, a CNA can definitely do that. Monitoring for indications of dehydration. No. That is a skill that is going to need to be done by the RN. 3. Administering half normal saline, also known as 0.5 normal saline, by IV line. No, they cannot give any medications. Okay, 4. Let me get this in frame. 4. Recording urine output when patient voids. Yes, they can absolutely do that. That is a part of gathering data, which is what a CNA does, also known as an AP. Assessing daily weights for trends. Can they do this? Yes or no? No. The key word is assessing. 6. Help the patient change positions every 2 hours. Oh yeah, they can absolutely do that. They can do LDLs, they can do position changes, they can do, I think I said LDLs, maybe I meant ADLs. They can do like hygienic stuff with them. Those are the things that they can do. They can gather data such as electrolytes. They can gather your daily weight, but they're not assessing your daily weight. That is going to be like interpreting their daily weight. If it said to measure their daily weight, that would be a different thing. Okay, number 13. An experienced LPN/LVN reports to the RN that a patient's blood pressure and heart rate have decreased, and that when his face is assessed, one side twitched. What action should the RN take at this time? 1. Reassess the patient's blood pressure and heart rate. 2. Review the patient's morning calcium level. 3. Request a neurologic consult today. 4. Check the patient's pupillary reaction to light. If you picked number 2, that is absolutely correct. So this can be a sign of low calcium. It's that Chevaux's sign where your cheek starts to twitch when you touch it. Also, another typical sign that NCLEX really loves with calcium is a Trousseau sign, where you hyperinflate the blood pressure cuff, and then you see the tendon in the wrist cause flexation of the wrist. You will see that in the patient as well, and that is a sign of low calcium. 14. The nurse is preparing to discharge a patient whose calcium level was low, but is now just barely within normal range. Which statement by the patient indicates the need for additional teaching? 1. I will call my doctor if I experience muscle twitching or seizures. 2. I will make sure to take my vitamin D with my calcium each day. 3. I will take my calcium citrate pill every morning before breakfast. Or 4. I will avoid dairy products, broccoli, and spinach when I eat. If you picked number 4, you're absolutely correct. That is not what we want the patient with hypocalcemia to say. We do want them to have dairy products. We want them to have those really good green leafy veggies. That's going to be really good in vitamin C. Those are foods that we want to encourage our patients who have low calcium to be eating. So anytime that it says which statement by the patient indicates the need for additional teaching, we know that what the answer we are looking for is an incorrect statement, right? They're going to need further education. All the other options are absolutely correct statements. So 15, the prescription for a patient with hypercalcemia would the nurse question? So they have high calcium. Would it be normal saline at 50 mLs per hour IV? Number 2, furosemide 20 milligrams orally each morning. 3, apply cardiac telemetry monitoring. Or 4, hydrochlorothiazide 25 milligrams orally each morning. If you picked number 4, that is absolutely correct. Yeah, so the other options that are going to be actually good interventions that we can do for these patients. However, a patient with hypercalcemia should not be getting hydrochlorothiazide. 16. The assistive personnel, the AP, asked the nurse why the patient with chronically low phosphorus level needs so much assistance with activities of daily living. What is the RN's best response? 1. The patient's low phosphorus is probably because of malnutrition. 2. The patient is just worn out from not getting enough rest. 3. The patient's skeletal muscles are weak because of the low phosphorus level. Or 4. The patient will do more for himself when his phosphorus level is normal. If you picked number 3, that's absolutely correct. So we do know that you need ATP for your skeletal muscles to have energy. That P stands for phosphorus. Now, when you don't have enough phosphorus, you're going to have weak muscles. So you are going to need help with your activities of daily living when you do have low phosphorus. You're going to have those weak muscles because they're fatigued. They don't have that energy. So that's why that is the correct answer for this question. Number 7. The RN is reviewing the patient's morning laboratory results. Which of these results is most concerned? 1. Potassium level of 5.2. 2. Sodium level of 134. 3. Calcium level of 10.6. Or 4. A serum magnesium level of 0.8. The one that is the most off is going to be magnesium of 0.8. So that one is the one that is the most off. Oops, I don't think you can see this. Sorry. So we're right here. So your magnesium of 0.8, that is the one that is the most off. All these other ones, yes, they're off. They're either off by 1 or 2 decimals or 1 number, and so yeah, we would still be concerned and looking at those, but the one that is by far the most off is going to be the one that we are the most concerned of, and in this situation it is going to be your serum magnesium level. So that's why that is going to be your priority. Which one are you going to be the most concerned about? You're going to be the most concerned about the lab that is the most off. So that one just comes down to actually knowing your levels. 18. Which patient would would the charge nurse assign the step-down unit nurse who was floated to the intensive care unit for today? 1. A 68-year-old patient on a ventilator with acute respiratory failure and respiratory acidosis. 2. A 72-year-old patient with chronic obstructive pulmonary disease, also known as COPD, and normal blood gas values, who is on ventilator dependent. 3. A newly admitted 56-year-old patient with diabetic ketoacidosis receiving an insulin drip. Or 4. A 38-year-old patient on a ventilator with narcotic overdose and respiratory alkalosis. If you picked number 2, you're absolutely correct. Now, the key thing in this situation and in this question is the fact that this patient is a float nurse. They're not on their home unit. So you should not be getting any type of typical ICU patients when you're floating to the ICU, which that really doesn't happen very often. But that can if you're in the step down. Now, I worked in oncology, so me floating to the ICU, that would never happen. It can't happen. However, an ICU nurse would be able to float to my unit, which is an oncology unit. They just wouldn't be able to take our core staff, or not our core staff, our core patients, like our typical oncology patients. They would get our med-surg overflow. So in this situation, it wouldn't be a patient that is ventilator dependent. It wouldn't be a patient who basically should be monitored by an actual ICU nurse. It's going to be the patient with the lower acuity, and I hate to say this, with like the easier patient should go to the float nurse. That should happen. Now, whether or not you see that in practice, that is a completely different thing. Okay, number 19. The patient with respiratory failure is receiving mechanical ventilation and continues to produce arterial blood gas results indicating respiratory acidosis. Which change in ventilator settings should the nurse expect to correct the problem? Now remember, they have respiratory acidosis. Number 1, increase the ventilator rate from 6 to 10. 2, decrease the ventilator rate from 10 to 6. 3, increase in oxygen concentration from 30 to 40%. Or 4, decrease in oxygen concentration from 40 to 30%. If you picked number 1, you're absolutely correct. So the reason why this is correct is because with respiratory acidosis, if you are not breathing enough, I have to take a minute and think about this. If you have slow and low respirations, you can have respiratory acidosis. However, if you're breathing too fast, that does cause respiratory alkalosis. So what we would want to do with the ventilator, we want to look at the setting, and we are going to want to increase the setting of the ventilator. We want to increase the respiration rate to a normal respiration rate. 20. Which actions should the nurse delegate to the assisted personnel for the patient with diabetic ketoacidosis? Select all that apply. Again, take this question answer by answer, true or false, yes or no. 1, checking the finger stick glucose results every hour. No. The reason why is because if a patient has ketoacidosis, they should be having that assessed by the nurse, because in case there needs to be a quick intervention, the nurse is doing it and they're right there. 2, recording intake and output every hour. Yeah, they can definitely do that. 3, measuring vital signs every 15 minutes. Yeah, they can measure. They cannot interpret or assess, but they can measure vital signs. 4, assessing for indicators of fluid imbalance. No, your key word is going to be assess. You can toss that out. Notifying the healthcare provider of changes in glucose level. No, that needs to come from the RN. And then 6, assisting the patient to reposition every 2 hours. Yes, they can definitely do this. 21. The nurse is admitting an older patient to the acute care medical unit. Which assessment factor alerts the nurse that the patient has a risk for acid-base imbalance? 1, history of MI, myocardial infarction 1 year ago. 2, antacid use for occasional indigestion. 3, shortness of breath with extreme exertion. Or 4, chronic renal insufficiency. If you picked number 4, that's absolutely correct. We do know that if you do have chronic renal insufficiency, you are likely to have some type of metabolic acid-base disorder. Occasional use of antacids, no, it's not going to cause acid base. If it's a daily use and persistent use, yes, definitely. If it is shortness of breath that happens every day and you have increased asthma attacks or stuff like that, yeah, you can definitely. However, it's just with extreme exertion. It's not going to be like everyday situation. But that chronic renal insufficiency, that is going to affect your daily acid-base balance. So that is going to be the correct answer. 21. A patient with lung cancer has received oxycodone 10 milligrams orally for pain. When the student nurse when the student nurse assessed the patient, which finding would the nurse instruct the student to report immediately? Is it going to be number 1, a respiration of 8 to 10 breaths per minute? 2, decreased pain level from 6 to 2 on a pain scale of 1 to 10? 3, request by the patient that the room door be closed? Or 4, a heart rate of 90 to 100 beats per minute? Now, which one do you guys think it is? If it is a respiratory rate of 8 to 10, then yes, you do. Now, we do know that oxycodone, that's a narcotic. Narcotics can suppress your respiration rate. So if they're breathing slow, number 1, if you haven't given it to them, don't give it to them. Don't give them oxycodone. It's going to further decrease their respiration rate. However, if you already did give it and you're noticing afterwards that they are breathing slowly, we're going to get them Narcan. We got to get them help, because your body cannot sustain low respiratory rates for an extended amount of time without having some sort of compensation. So that's why. The other ones, those were pretty good, right? And then the requesting the patient door to be closed, that's not really something we need to immediately report. Heart rate of 90 to 100, that's pretty good. And then decreased pain, that would be an expected finding. That's what we're hoping, right? Okay, 23. The assistant personnel reports to the nurse that a patient seems very anxious and vital signs measurements included a respiratory rate of 38 breaths per minute. Which acid-base imbalance should the nurse expect? 1, respiratory acidosis. 2, respiratory alkalosis. 3, metabolic acidosis. Or 4, metabolic alkalosis. If you picked number 2, that's absolutely correct. When you have increased respiration rates, you are going to be breathing off too much CO2, making you alkalosis. When you have too much CO2 that you are retaining, that makes you acidotic. However, you're breathing off too much CO2 when you are hyperventilating, causing you to be breathing off too much CO2. So what do we do in this situation? We give you a paper bag and we have you rebreathe the CO2, and hopefully that can balance that out. 24, a patient admitted to the oncology unit for chemotherapy. To prevent an acid-base problem, which finding would the nurse instruct the assistant personnel to report? 1, repeated episodes of nausea and vomiting. 2, reports of pain associated with exertion. 3, failure to eat all the food on the breakfast tray. Or 4, patient hair loss during this morning's bath. Now, what do you guys think it's going to be? If you did pick number 1, that's absolutely correct. Now, the reason why is because when you have lots of nausea and vomiting, especially vomiting, that can make you metabolic alkalosis. The reason why, you kind of want to think of it this way. You have stomach acid in your stomach, right? Your stomach is very acidic. When you're vomiting, or if we are suctioning the stomach too much, we remove too much of the acid, causing you to be basic, known as alkalotic, causing you to be metabolic alkalosis. So that is why that is of a concern. Reporting pain with exertion, kind of an expected finding. Failure to eat all the food on the breakfast tray, that's not going to cause any type of acid-base imbalance. That can be the disease process of cancer, or that can be a result of the medications that we gave them. Hair loss during the morning bath, that can also be because of the chemotherapy. That can induce alopecia, so that would not be a very concerning finding. However, we do want to get on top of that nausea and vomiting. Okay, 26. The patient has an order for hydrochlorothiazide 10 milligrams orally every day. What should the nurse be sure to include in the teaching plan for this drug? Select all that apply. Number 1, take this medication in the morning. That's absolutely true. Now, the reason why is because we don't want to take this medication later in the day or even in the evening, because this is going to cause us to pee all through the night. And we want you to rest. Your body needs to rest. So we don't want you taking this late in the day. Going in the morning is much better. 2, this medication should be taken in 2 divided doses, half when you get up and half when you go to bed. Absolutely not. Especially do not take this before bed. You need to take this in the morning. Again, you're going to be peeing all night if you take this at night. Number 3, eat foods with extra sodium every day. Absolutely not. This is a diuretic. We're trying to get fluids off of you. Sodium attracts water. Water fangirls and stalks sodium. Sodium and protein. In this situation, let's just talk about sodium. So if you have an increased amount of sodium, it's going to increase the fluid retention in the body, which is going to defeat the purpose of taking hydrochlorothiazide. Number 4, inform the patient, inform your healthcare provider if you notice weight gain or increased swelling. Absolutely. Yeah, you do want to do this because this is a sign that the body is retaining more fluids. And we are probably going to have to do diurese you a little bit more aggressively with IV diuretics. We're possibly are going to have to do a fluid restricted diet and so forth. Number 5, you should expect your urine output to increase. Yes, absolutely. That's one way that you're going to evaluate whether or not a diuretic is working. You should be seeing the patient needs to pee relatively quickly. With anything that has to do with an oral intake, it usually takes about an hour to really hit an effect. For an IV, maybe 15, maybe 20 minutes, that patient should have the urge to pee. Number 6, your healthcare provider may also prescribe a potassium supplement. That is true, just to make sure that we're not losing too much potassium. Okay, so 27, which blood test result would the nurse be sure to monitor for the patient taking hydrochlorothiazide? Is it going to be sodium, potassium, chloride, or is it going to be calcium? If you picked number 2, potassium, that's absolutely correct. It kind of ties into the previous question where you should expect your provider to give you some sort of a potassium supplement, because this can actually make you urinate out more potassium than what we need you to lose. So that's why that would be an important teaching for this patient. Okay. All right, let's try and get this all situated. Okay, almost done. 28. The RN is providing care for a patient diagnosed with dehydration and hypovolemic shock. Which prescribed intervention from the healthcare provider should the RN question? Let me see if I can fix this. Okay, hopefully that looks a little bit better. 1, blood pressure every 15 minutes. 2, place 2 18-gauge IV lines. 3, oxygen at 3 liters via nasal cannula. Or 4, IV 5% dextrose in water to run at 250 an hour. Now the patient is dehydrated. They're in hypovolemic shock. If you chose number 4, that is absolutely correct. Now, the reason why number 4 is incorrect is because with 5% dextrose in water, what happens is that dextrose gets metabolized extremely fast in the body. So all you are left with is just water. When a patient is in hypovolemic shock, they need isotonic solutions. They need that isotonic fluid. So that can be your lactated ringers, also known as LRs, is what you'll hear them be called, or it could be like your normal saline. That's basically what we're going to be giving you. For hypovolemic shock, all these other orders are going to be absolutely appropriate. We're going to be monitoring their blood pressure very closely and very frequently. That's those frequent vitals every 15 minutes. We definitely do want to get 2 IV lines going that are at least 18 gauge. The reason why is because if they need blood products, there's an appropriate sized IV line ready to go. And then oxygen, yeah, patient is in shock, you put on that oxygen. So those are going to be your hypovolemic shock, not parameters, but like treatments. And so what you're going to be doing. 29. The student nurse, under the supervision of an RN, is reviewing a patient's arterial blood gas results and notes an acute increase in arterial partial pressure of carbon dioxide, which is PaCO2, to 51 millimoles per of mercury compared with the previous results. Which statement by the student nurse indicates an accurate understanding of an acid-base balance for this patient? Is it 1, when the PaCO2 is acutely elevated, the blood pH should be lower than normal? 2, this patient should be taught to breathe and rebreathe in a paper bag. 3, an elevated PaCO2 always means that a patient always has an acidosis. 4, when a patient's PaCO2 is increased, the respiratory rate should decrease to compensate. If you picked number 1, you are absolutely correct. When the PaCO2 is acutely elevated, the blood pH should be lower than normal, indicating acidosis. Okay, 30. The nurse is providing care for several patients who are at risk of acid-base imbalance. Which patient is most at risk for respiratory acidosis? Number 1, a 68-year-old patient with chronic emphysema. 2, a 68-year-old patient who uses antacids every day. 3, a 48-year-old patient with anxiety disorder. Or 4, a 28-year-old patient with salicylate intoxication. Now, if you picked number 1, you're absolutely correct. Now, the reason why is a patient with asthma, COPD, or even emphysema, they are going to be retaining too much CO2. They're going to be retaining too much CO2, causing them to be acidotic, involving the respiratory system. For number 2, that is going to be causing you to be metabolic alkalotic. For number 3, that's going to be causing you to be respiratory alkalotic. And number 4, that is going to be causing you to be, I believe it's metabolic acidotic, if I'm not mistaken. Okay, so 31. A nurse is caring for a patient who experiences frequent generalized tonic-clonic seizures associated with periods of apnea. Apnea means they stopped breathing. The nurse must be alert for which acid-base imbalance: respiratory alkalosis, acidosis, metabolic alkalosis, or metabolic acidosis. If you picked number 4, you're absolutely correct. The reason why it is going to be number 4 is because when you do have a seizure, even though, yes, you can stop breathing, and that's going to make you want to choose anything respiratory. However, you have a buildup of lactic acidosis, and that needs to be excreted by the kidneys. And so you're going to have a higher amount of lactic acid in your system, causing you to be metabolic acidotic. So that's the reason why. Okay, 32. The nurse is completing a history for an older patient at risk for an acidosis imbalance. Which questions would the nurse be sure to ask? Select all that apply. Number 1, which drugs do you take on a daily basis? Yeah, that's a great question to answer or to ask for the patient. 2, do you have any problems with breathing? Yep, absolutely a great question. 3, when was your last bowel movement? Not really so much. Nope, you don't have to worry about that. Number 4, have you experienced any activity intolerance or fatigue in the last 24 hours? Yeah, if you have any changes in your your ability to breathe, or if you feel short of breath, you feel like you can't do your activities of daily living like you usually can, we definitely do want to know that. Number 5, over the past month, have you had any dizziness or tinnitus? Not so much. That's going to be more a neuro-driven question, not necessarily an acid-base question. Number 6, do you have episodes of drowsiness or decreased alertness? Yes, the reason why is because if you do have these episodes, we know that this can decrease your respiratory rate, increasing your risk of having respiratory acidosis. Now, kind of diving back into number 3, because I don't feel like I really explained that very much. The reason why number 3 is incorrect is because the bowels, that doesn't really have anything to do with acid-base balance. We do know that if your kidneys are involved, then yeah. If this was like poor production of urine or any changes of urination, stuff like that, yeah, we would want to look at that because that's going to be a sign of metabolic. Anything that's going to affect the changes in your breathing, quality of breathing, yeah, we do want to know that because that's going to be respiratory driven. Anything in mental status changes, yes, because that can be either or, really, with metabolic or respiratory. We can cause those imbalances. Okay, number 33. So which specific instruction does the charge nurse give the assistive personnel, the AP, also known as the CNA, helping to provide care for a patient who is at risk for metabolic acidosis? 1, check to see that the patient keeps his oxygen in place at all times. 2, inform the nurse immediately if the patient's respiratory rate and depth increase. 3, record any episodes of reflux or constipation. 4, keep the patient's ice water pitcher filled at all times. Now this one seems a little bit weird, but it is too. It is too. Now the reason why is because this can show signs of compensation. If you're metabolically imbalanced and you maintain that, what can happen is your lungs, your respiratory system can soon follow, causing some type of compensation for that. So that's something that we do want to look out for. Also, we're going to be looking out for urine output, quality of urine, how much is coming out, are they retaining, and so forth. Eyes and nose, daily weights, those are things that we're going to be definitely concerned about. Okay, so last question of this chapter. So we have a case study and question. The nurse is admitting a 72-year-old patient from the healthcare provider's office to the medical surgical unit. The patient was alert until recently and has become confused. Over the past 36 hours, the patient developed signs and symptoms of fluid overload. On admission, assessment which manifestations would the RN expect to assess? Now we look at the vital signs, right? This is basically like a next gen question. So vital signs, the pulse is 112 beats per minute, respirators are 34, and blood pressure is 168/94. And then let's look at the instructions. Read the case study on the left, which we did, and circle the numbers that best answer the question. So the question is, so on admission assessment, which manifestations would the nurse expect to see on this patient? Would it be increased heart rate? Yeah, we can definitely see that on this patient. The blood pressure is elevated. We can see an elevated heart rate. 2, weak, thready pulse. Not really. It's probably going to be bounding. 3, alert and oriented. No, because look, the patient was alert until recently become confused. So that is why they are not going to be alert and oriented, right? It's in the case study. Also, why they're going to have increased heart rate is because we're looking at signs and symptoms of fluid overload. They're going to have bounding pulses. They will not have weak threading pulses. Weak thready pulses are with fluid deficit. They're really like dehydrated. 4, pitting edema of the lower extremities. Yeah, you can definitely see that in a fluid overload patient. 5, deep respirations. No, they're going to be more shallow respirations. 6, distended neck veins. Absolutely, that is a big sign of fluid overload. Bilateral rhonchi? Not really. We would more likely hear like crackles. We can also hear a pleural rub. It sounds like a balloon is being rubbed in the thoracic cavity. But those crackles are usually what we would expect to hear. 8, hyperactive bowel sounds. That actually can happen. Yeah, we can actually have hyperactive bowel sounds because there's a lot of fluid going on, going through the intestines, and could cause some diarrhea. Number 9, weight loss. No, we're going to see weight gain. So we would see an increase of their weight on the scale. And 10, pale, cool skin. Yeah, they can definitely have pale, cool skin. The reason why is because they are edematous. They have fluids. That increased fluid makes their skin feel a little bit cool. Could also be taut, shiny, right? Can have that pitting edema and so forth. So this is just one of the chapters of this book is really good. It's really good at teaching you how to answer NCLEX style questions, how to find those keywords in assessments, and how to prioritize and delegate any type of situation. So I will be going over these more in the near future. I also have a podcast that I have started, very new. You can get it on any type of podcast platform, Apple Podcasts, Spotify, you name it, I'm on there. And it is called Rosie the Riveting RN. It just goes over some information on different nursing topics. I'll also be going over how to read the textbook, a couple more chapters on that one as well. And then I'm also offering tutoring sessions as well. However, if you are one of my students or if you do attend the school that I do teach at, I unfortunately cannot tutor you as it is a conflict of interest. However, if you are not a student of mine or you do not go to the school that I work at, I would love to help you out. Reach out to me. Other than that, please like, rate, subscribe, comment. That really helps the channel as well. So I hope you guys have a great day. Let me know what other topics you want me to go over and stuff like that. Good night.